My name is Alyssa Brown, and I'm an American Heart Association volunteer. I also am a parent of a daughter that has 4 congenital heart defects. She's cute. I brought her photo. And we're here today to demonstrate pulse oximetry. It's a safe, quick, and non-invasive way to detect congenital heart defects, and it can help to save the lives of Florida children. Pulse oximetry screenings are easy, inexpensive, and painless. They're a way to ensure that babies go home from the hospital safe. And current screening methods, which include ultrasound and physical examination, pick up less than half of the occurrences of critical congenital heart defects. Without a pulse oximetry screening, a child is between 4 and 5.5 times more likely to go home, presumably healthy, but with an undetected defect. Undetected heart defects can lead, at best, to avoidable health complications and expenses, and at worst, to death. Pulse oximetry screening could help to detect an additional 30% of critical congenital heart defects cases. And so that's why we're here today, and we've invited you to demonstrate for you how easy this is. You've got more information in your packets, and you will be able to access those after the demonstration, and we're happy to answer any questions that you have. We also have 2 adorable volunteers here, Miss Ava and little Mr. Jason, who have graciously been volunteered by their parents. So thanks so much to the parents. And so we'll go ahead and get started.
And what we do is we just apply the O2 sat onto the right wrist, and it's going to take a few minutes before it starts reading, which was a lot quicker than for her. There you go. So it's 100% oxygen on her right wrist. That's what we want. Exactly. And then we go ahead and do a reading on either foot. I know, I'm sorry. Should pick up because she's not moving too much. Usually they're fighting us. And she's 100%. So basically what we do is we look at and measure a difference between the right wrist and either foot. And if it's like greater than, less than, or equal to 3% difference on either reading, we repeat the test in an hour. And then if we get the same difference again, we repeat it another hour later. And if we get 3 tests that have a difference in it, then we call the physician, and they usually get a referral to a cardiologist. Get an echocardiogram. That's it. On the inside of his wrist here, the light up part, sensor. Okay. Ooh. Oh.
How's he sleeping? Oh, Jason. Okay. Listen. There you go.
Roll this. There you go. He's 97%. Looks pretty steady. You can tell by the waveform also on there. It's a good signal. Okay. he's reading 100%.
So I'm Louis St. Petrie. I'm a pediatric cardiologist, and just to put this in perspective, there will be legislation introduced this year, and there was last year, but it didn't make it through the process, that mandates that all newborns receive pulse ox screening. And the point of the demonstration is that it's simple. It's also very inexpensive. Pulse oximeters come in all sizes and shapes. I brought one from the office, not sure if they had one here today. And the test just costs pennies to accomplish it, and it's totally non-invasive. And the point of that is that there are certain heart defects which cannot be detected in the newborn nursery because they don't have murmurs, they don't have other signs or symptoms, and so you don't know about that. And they form a small percentage of the kind of heart defects that kids have, but they're very important because kids with those small percentage will frequently come back to the hospital a few days after discharge, and they'll be dead, or they'll be a near death, because they have a kind of defect where if certain changes occur after birth, which are normal, they lose all oxygen supply to their body. And if they survive, they very frequently are brain damaged, whatever. It's a terrible thing to happen, and it's so simple to prevent. So how many tests do kids go through? There's a newborn metabolic screen in the legislation that's proposed would add this to the newborn metabolic screen and make it part of that one test that all kids get. Part of it is a blood test, and then the other part would be this pulse oximetry screening. So, this became available back many years ago. In 2003 was the first article in the journal Pediatrics, and I went to the staff at Tallahassee Memorial, and so ever since 2003 we've screened every child who was born at TMH, and we no longer have kids coming in who have died or almost died as a result of severe congenital heart disease. So it's easy to detect, but not all places do it, and the purpose of the legislation is to have all places do it. The CDC is now recommending that for all nurseries, and it's so simple, it's so inexpensive, and it just makes great sense to go ahead and do this. I think that the only cost is going to be the administrative cost for Children's Medical Services within the Department of Health, who will have to administer this program. As far as the cost to the patient, it's minimal. It's just a few pennies for a pulse ox test. Pulse ox meters are everywhere. You go to the emergency room, you go to the nursery, you go any place in the hospital, you go to a doctor's office, they're everywhere. And they're very simple to use, they're very accurate, and it's just a matter of applying the technique at the appropriate time.
You know, if it's so simple and cheap, it's kind of hard to understand why a hospital wouldn't do it as a matter of course.
I think that it is an item that's just come to light as a great way to detect this undetectable problem, and I think that screening and prevention are really the way you have to go for most things, and I don't think that's been popular up until recently.
What happened to the legislation last year?
It had a fiscal note which was unfortunate and not correct, and because really it's very inexpensive. It will cost the Department of Health some funds to administer the program, but in terms of driving up insurance costs and whatever, that's crazy. It's not really going to do that.
What's the cost if a baby has to come back to a hospital? I mean, what's the cost?
Thousands of dollars, and you know, if the baby dies, what's the cost to that family? And if the baby's brain damaged, what's the cost to that family and to society? It's so simple, it's crazy not to do it.